Welcome, moms and dads. My name is Debbie Smith, and I'm a retired pediatric occupational therapist that worked with children for over 40 years. I have 4 children and 6 grandchildren, so I've been surrounded by babies for a long, long time. So I love doing these classes to educate new moms and dads, or if you've already had children, sometimes you might learn something new just by listening to what I'm going to talk about today. I'm going to be going over briefly the different developmental stages through 12 months. I sometimes stopped at 6 months, but I think it's important to take it through the first year so you can kind of get a feel for what to expect. Now, I also want to mention to you, and I used to tell this to the moms when they would come in, is that these are just averages, guidelines. So in other words, if I say a milestone is achieved at a certain month, know that development is not an accurate thing. It's like some babies achieve this earlier, some a little bit later. And I always get questions later on from moms, when is it time to worry? And I'll go over that a little bit later on, but know that just from my experience in the pediatric therapy world, as well as raising my own children and even looking at my grandchildren, their development, like one grandchild is way ahead in speech, but physically she's not nearly where the other grandchild is, and he's not. His speech development's a little bit different. So every child has their own little blueprint, and so know that don't get too concerned and hung up on these months that I'm going to mention as to when they should be doing certain things. And I know if you're a first-time mom, it's hard not to do that, but just know that if you do have a concern, always call your pediatrician and ask them. But usually they're just either a little bit behind or can be way ahead. There's just a continuum of differences here with development. So I just wanted to put that out there first before we get into the actual stages, so you don't get too concerned. And typically what I'd like to do in these classes is actually see hands-on with you and your babies, but we'll have to do that another day when all this craziness goes away, and hopefully we can meet again in person. That's my wish and prayer for you guys. So anyway, so let's get started. I will be also putting up a handout so you can kind of go over this with me line by line later on, so you don't have to take notes right now as I'm talking. So sometimes you just need to listen and not be writing away if you are a note taker. Okay, so when you take home this little bundle of joy from the hospital, it's a little daunting thing to see this little totally dependent little creature in your arms, but I just wanted to kind of go over what to expect. The babies typically are born with lots of flexion. So they in utero are all balled up like this. Their fists are usually fisted, their hands are fisted, they've got some tight arms, and even when you start giving them a bath or washing them down, it's like, oh, you're fighting with it, getting them, all stretched out to get in between all these creases. So, but that is neurologically a good thing, because we want that. This is how life starts out, the babies are all in flexion. So eventually, and also, the only way the babies can communicate, as you know, is through crying. So sometimes we're good at figuring out what kind of cry it is, whether it's a hurt cry or a hungry cry, or a I need to be changed cry. And sometimes it's you just throw your hands up in the air and say, I just don't get it. Why are they crying? But that's the challenge of taking care of a newborn until they can communicate more and their cues. And sometimes moms are really good at getting those cues, and sometimes they're just have to figure it out. Eventually you will. Babies can see best from about 8 to 12 inches. Their eyes are not developed well, their eyesight, I should say. And so there's a lot of blurriness. So when you're trying to either put your face, close up, or a toy, make sure you hold it fairly close to them so they can actually see it and focus on it. Eventually, as the months pass, their acuity will get better. But right now, when you first bring them home, they're a little bit fuzzy. Their hearing is great, though, from the beginning. They may respond to familiar sounds or smells. So there's lots of ways you can kind of give them some good sensory input too. Singing, music, relaxing music. Those are all good ways to give your baby some good input. Initially, from birth to 2 months, they're able to turn their heads from side to side, okay? Whether it's on their tummies. Hopefully you're doing some more tummy time, because I just finished doing a class on tummy time. So they're eventually going to lift their head up and turn it from side to side, okay? And eventually they're going to get some more nice neck extension and develop these nice muscles in through here in their back and their lower back here. Their hands are still fisted, and they're gonna pretty much stay that way for a couple of months, and you're gonna see some opening of their hands later on. I'll get to that in a little bit. The babies love to have that pressure of being swaddled. I know that we had a woman come in and she really talked about how to do a good swaddle. I was never really good at it. Maybe you can find some things online that can show you, but that pressure of those babies, first of all, when their arms are out like this and you're trying to get them to sleep on their back, they have what we call a startle reflex. So when they move, they startle themselves and they wake themselves up. So swaddling kind of takes care of that, because then you've got that tightness, that tight wrap with your nice soft blanket around them, to where their hands are not out and flailing about, because that really does interrupt their sleep. We don't want to do a heavy swaddle on their legs. We don't want their hips up like this. We want them down. So again, there's lots of different references on how to do a good swaddle on a baby. But I find that especially when they're on their backs and they don't have that pressure on their tummies when they're sleeping, they need to feel boundaries around their body. So just putting them unswaddled, they're not going to be too happy sleeping. So swaddling is a good tool to help your baby sleep a little bit better. So also, again, any questions, refer to your pediatrician or your nurse practitioner, and maybe they can help you, show you some different things as well. So their vision is getting better on the sides. They get more lateral vision. And then 3 to 4 months, they start what we call weight bearing on their tummy. And that means that they're going to bear some weight on their elbows, on their shoulders. They're going to start lifting up a little bit like this and putting some pressure on here and here, which is great for developing muscle control and muscles around the shoulder girdle area, and then also in through the elbows, and then pressure on the hands. So they get a nice opening of the fist. Then you're going to notice at 4 months, they're going to start being more reactive to your face. They're going to start cooing and smiling, reacting to different sounds and songs and sights, and a lot more fun to be around versus the early days of the newborn, the 1 month old. It's fun to see them. They know their mom's voice or their dad's voice. They're differentiating between that. Even smells. They know, they can smell your mom. They can smell, I know, I think it was my daughter that did, when she had to bring her baby back to daycare, she brought a shirt with her that had her smell on it, and just let the baby, snuggle with it. And it was a very comforting thing, because they recognized that was mom's smell. So I thought that was fascinating little tidbit there. At 5 months, we're going to see what we call a full extension weight bearing. When they're on their tummies, they're going to go push all the way up and lift up like this. And when their arms are out straight, and they're getting a good stretch in through here. So these are steps. Each step prepares the baby for the next developmental stage. So this one will prepare the baby to eventually go into a roll. And it eventually is going to develop all these muscles in the torso and the trunk, and eventually get the baby to where they can maintain an all-fours position, which is, again, right before they learn how to do a crawl. Okay? On their back at 5 months, or a little bit earlier, you may see them bring their hands to what we call midline, in the center of their bodies. So they're also going to discover their hands. They're going to look at their hands. They're going to look at their fingers. You may have a baby that likes to mouth their hands, which is a great way of providing a lot of good oral input into their mouths, which is important to desensitize their mouths so they can accept different textures. And also for teething, obviously they're going to be gnawing on fingers when they want to bite down on their gums when they're teething. So bringing their baby's hands to center like this, doing patty cake, all good activities to help encourage that. And they're going to do this on their own as well. And also you're going to see some reaching out. And usually babies are in the containers and their little infant seats or on their backs. And they're going to start opening their fist and actually doing an active reach for toys. So this is the time when you can get your little toys like a rattle or something that's a little bit smaller that they can actually open and grasp onto, and then bring it in front and watch it. You can also do hold a toy while they're on their backs, a colorful toy with a rattle so they hear it, and you can have them track it from side to side. You can do this with even newborns will track a little bit if it's close enough. So that's a great, so it gets their eyes to focus and work together. And then also they're learning to turn their heads as well. So that's another good activity for them when they're younger too as well. Okay, so rolling usually occurs, again, the more tummy time you do, you're going to see these progress a little bit faster, I think. So rolling, 5 to 6 months, you're going to get some rolling. Now, it used to be when we put all of our babies to sleep on their tummies, which we don't do anymore, we would see the rolling occur first from tummy to the back, because that's just the way they're naturally developing all of these muscles here, and they just get to that rolling first. Now what we're seeing is babies usually start rolling from their backs to their tummies first, and then vice versa, which is okay as long as they keep doing it. So you're going to see the baby roll from their back to, sometimes they get stuck on their side because their arm gets stuck, and that's when they get frustrated. So you know, if they're not happy and you see them initiate a roll them back on their backs, or help them complete the roll and try and get that arm untucked like that, so they are rolling on their tummies. Okay, and then you're going to see when they start pushing up like this, you're going to see a roll here back onto their backs. Again, rolling is important for developing these muscles in the trunk, which again later prepares them for crawling, standing, and walking, and sitting as well. So again, speaking of sitting, 6 months, we're going to see some not independent sitting, but we're going to see a little bit of what we call tripod sitting, where the baby's going to lean forward and kind of hold themselves in this position because they're not quite ready to sit independently yet. One thing I want to mention is I see a lot of these, and these are great little containers. I think they're called extra saucers, where you put them in and they hold the baby, and then there's a bunch of little activities around them. But what I want to caution you parents about is putting them in too soon, because I've seen babies as young as 3 and 4 months in there, because parents think that this is a good thing for them to, you know, start walking or just sitting up. They're too young for that. They're not ready for it. And I think when you get a baby that doesn't have good postural control and you put them in these little containers, it's not good. It's not good for their hips. They're not in a great position because they're kind of slumped over like this. So we want to refrain from using that equipment until later. I would say 6 months, 5.5, 6 months, you can start putting them in there. And I know it's a great way to control and keep the baby safe while you're doing activities, and that's great. Floor time is the best thing to do for your babies so they can freely develop and move. But you know, the extra saucers have their place as well, but just caution you not to put them in too soon. I always talk with my physical therapist friends, and we always talk about that, how parents tend to do that way too soon for them. So we didn't have those things when my kids were babies, so we didn't. It was, you know, the floor or me holding them or an infant seat. So anyway, okay, so The sitting is what we call ring sitting and prop sitting. Their legs are going to be like this, and they're going to lean forward. So giving them the opportunity, either putting the boppy, you know, if a lot of moms have these boppies, and putting that around them to give them a little bit of support at the hips, and letting them kind of like figure it out. And eventually they're going to get tired, and they're still not quite ready, but eventually they're going to be doing some nice sitting. But that's probably where they're going to stay for a little bit. And so what we do, they will develop what we call transition movements. So from sitting, they're going to be able to move to go back on their tummies, or sometimes they fall backwards and lose their balance. That's why you have to do this, really watch them and make sure they're safe. But the transition movements usually happens at 7-8 months. So you can help them do the transition movements if you hold them by their hips, and you kind of bring them forward and let them slowly go down to their tummies. Okay. Now that from this position up to sitting comes a little later. It requires a lot more muscle control and a lot more muscle development. So right now we're going to just focus on the sitting part and the transitioning down. So you can take them down slowly. Okay. Let's see here. The teething, I didn't cover teething. I've seen some babies start teething as early as 3 months. Just tons of saliva production, and they're just gnawing on everything. And sometimes those teeth take forever to come through. Sometimes you'll see the first tooth pop through at 6 months. Again, timeline on the teething really varies greatly. It could be as late as 8 or 9 months for that first tooth to pop through. Some babies have them at 3 months. So again, you know, no worries if you don't see the teeth, or if you see them too soon. It's just where your baby's at right there. They can see full color at 7 months, which is interesting. Their hearing is fully developed. And then at 7 months, they can start to bear some weight on their legs when they're held upright. Until then, you're still going to get that flexion, and they're really not doing much with these legs. They can't do much. So 7 months, you can start kind of doing a nice stand and see, you know, obviously hold on to their torso like this. And so again, that gives them nice good input into their hip socket, their joint here. And so again, preparation for walking. Okay. 8 months and 9 months, you're going to see, hopefully, if we've done enough of our tummy time, we're going to see these babies start to do the all four position. And this is the precursor to crawling. So they're going to just hold it like this and then collapse. They'll probably hold it like this, do a little bit of rocking, which is a great way to stimulate the muscles in here in the hips, the rocking back and forth, and then hold it. And then down they go. So that's always exciting to see that the first time. And then again, 8, 9, 10 months, sometimes a little bit later, sometimes earlier, we can start to see a crawl. And I want to emphasize crawling, the skipping of the crawling stage is something we don't want to see. We really want to get them crawling because that reciprocal movement is really important for brain development. Okay. Sometimes babies that have not developed a good control in here go straight to either they do the butt scooting, we call it butt scooting, so they don't ever get that input into their hands and their arms, and they just move around like this. And again, this kind of impedes all this development here. So we really want to help crawling. And I've even done where babies really get stuck, if they're just stuck here, I even actually move their arms and legs through the process so they get it like that. Okay, I think, and then at 9 months, 9 to 10 months, you're going to see babies pull up on something and stand. Again, preparing them for walking, and they're just going to stand, maybe let go, maybe fall down. So obviously you want to watch out, make sure they don't hit their heads on anything, on a coffee table, or they may pull up in their crib and try and stand there. So again, you can see it as early as 7 months, you can see it as late as 10, 11 months, okay? So good standing, that's a great activity for them to stand, and again, get that, strengthen those legs and strengthen those hip joints so they get that nice push down input and helps activate those muscles. And then walking, usually there's such a range of it. I've seen babies walk as early as 8 or 9 months, which is really early, or as late as 15 months. Again, check with your pediatrician, but don't panic if your baby isn't walking by a year. Actually, I remember thinking with my first baby, I can't wait till they start walking. When are they going to start walking? And then once they start walking, it's like, oh, why did I wish for this soon? Because now they're into everything and they're falling and hitting their heads or whatever. So the fun begins when they start walking. So again, if you do have concerns, if your baby you feel is delayed or is late walking, check with your pediatrician. But I think those ranges again, 14, 15 months, maybe you need to work on strengthening their core muscles a little bit too. But that's something your pediatrician needs to help you with, or a therapist that's a pediatric therapist. So I think that we have covered everything. I wanted to show you just one thing to help babies with their sitting balance, and something I did even with my own grandchild in therapy a lot. When they're still a little bit stuck and they're not doing really good sitting or good transition movements, well, you really need to work on the core. So a couple of things I would do is I would first put them on their tummies and really move forward till they kind of move back and forth like this. And then I would sit them. And you could do this facing them because I think it's not as scary because right now I'm behind because of the camera, but facing them, holding them at the hips, doing a nice little bounce so they get that nice little up and down movement and that input into their inner ear, and then slowly moving them from side to side like a tipping motion. And what you're going to see is their body is going to react to the movement, and they're going to move opposite to the direction of where you're moving. Okay, so what that's going to do, again, stretch this side of the body, stimulate this side of the body to work, and also moving from back. And then they have to right themselves. So they're using these muscles here and these muscles. So really a great core activity exercise. It's very easy to do. You can do it in front of a mirror or face them and kind of sing to them. Sometimes they're not real comfortable with it. You can do a nice little circular movement like this, but it really helps get the core, especially if your baby's struggling a little bit of with getting her sitting balance or getting in and out of that position. We'll need to work a little bit on strengthening that core. And it's a nice fun activity to do. They usually love the cute little bouncing thing too, and I usually sing songs with it too to kind of distract them and make good eye contact with them. So that's a fun activity. You can take your exercise ball that you have at home. It's pretty cheap and inexpensive. Let the air out of it a little bit so it's not so hard. So we can do some bouncing on it and work on that a couple times a day or once a day, whenever you have time. All right. Okay, so I think we are good. I think, I want to show you just a couple of other things here. I showed this on my Tummy Time class. Just some suggestions for activities. First of all, I am a big believer of old-fashioned toys for babies. All those lights and loud sounds are way overstimulating for babies right now. Go back to the basics and you think about what a basic toy does. If it's got a texture, or it's good for their grasp, or if it's something that they can take and mouth. Those are things that really help babies' development. They don't need these electronics this early. Toddlers, maybe that's fine. So anything that's going to stimulate their development. I love these little play mats. You can get these online anywhere. Things that are dangling to where they can reach out and grasp. You can get water mats, which are great for tummy time, and they have like a little activities, not activities, they have like little objects and glitter, and so when the baby presses on that water mat, it moves it. That's a great activity for when you're doing tummy time with them. You can get little pillows to help with your tummy time that you can prop them up on their chest. And then you've got your exercise ball here. And rattles, again, just anything that they can, look at the size of their hands and that they're able to grasp. Blocks are great. any old-fashioned toy, rattles, and again, not too many lights and sounds, so the baby's not too overstimulated. So, well, I wish I could take all your questions, but hopefully, maybe in the next few months, we'll be able to meet again. We'll see how it goes, but I wish you all health and happy times with your baby, and hopefully we'll see you soon. Thanks.